Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could join us for the second segment. Once again, I've got a terrific guest, physician's assistant Thomas Trotter. Mr. Trotter, thanks so much for being here.
Thanks for the opportunity, Dr. Morwood.
Well, Mr. Trotter, you know, a lot of people aren't familiar with the concept of physician's assistant, and I'm delighted that you came on the program. We're going to talk about so-called physician extenders, and we're going to talk a little bit about the difference between nurse practitioners and physician's assistant and how you got into it, etc. But let's start off by talking about your background. Where are you from?
I'm from San Diego.
From San Diego.
California boy.
Well, I understand San Diego has some of the best weather in the world.
It is a very beautiful place. It's getting a little big, but it's a very beautiful place.
It is. So, Mr. Trotter, how did you get into being interested in being a physician's assistant?
Well, it was very roundabout. I was already finished with my undergraduate, which was in business, and I was working weekends as a kayaking instructor for an outfitter in San Diego, and to be able to lead trips around the southwestern United States and in Mexico, we had to have a certain level of medical training. So I became what was called a wilderness first responder, and after that, I really enjoyed the medical aspect, and one of my colleagues at the time had just finished her master's degree and said, you know, you should really look into this PA thing. It was a long time ago. At the time, there was only 25 programs in the country, and now there's about 130. And I literally, the next day, I called the national organization, got all the information, and never looked back.
And the rest is history, so to speak.
Exactly.
So, PA stands for Physician's Assistant.
Indeed.
And how long have you been a PA, Tom?
This is my 12th year.
12th year. Okay. Now, does California require that PAs be licensed or certified, or can you just get a degree or finish a program and then go to work? I mean, how's that work?
That's a good question. No, we're certified, and after your training in PA school, there is a national exam. We do have a governing body, the National Association of PAs, and you have to pass a national test to be able to actually practice.
So what's the training like? Can you go from high school? Do you have to get a college degree first? Do you have to have an interest in science and biology? I mean, what's the training for PA?
You have to have your undergraduate and usually some level of experience prior to getting in. There's a lot of competition to get in. In fact, in my program, there were 33 spots and over 600 applicants. So they look for people who have a little prior experience. And
so it sounds like it's very selective. I mean, there were 600 applicants for 33 spots.
Exactly.
Well, Mr. Trotter, you're the so-called cream of the crop. It's great, great that you made it, and great that you work with us. So before we go on, I just do want to emphasize that you're not an official representative of the hospital where you work at now. You're working in an emergency room in the area at a very good hospital, but you're not here officially representing the hospital. But I think it's great that you come on the program because a lot of people in the community are very fascinated and interested in what a PA is doing these days, especially working in the emergency room. And I will mention that I've been very fortunate to work with you a lot, and I know you're terrific, and so I'm happy to have you on the program.
Thank you, Dr. Morwood.
So there's three issues that I want to focus on. Really, everybody's interested these days in medicine and surgery, especially in the emergency room. There's three issues that we focus on. I think there's quality, and there's safety, and there's economy. So you're called, one of the things that you could be called is a physician extender, isn't that right?
Physician extender, mid-level.
Okay, so mid-level or physician extender. So there are certain patients or certain problems that you can see in the emergency room and handle yourself, or you check with a doctor. Now, how's that whole thing work? Does somebody come in and you can see them independently? Does the doctor have to review your chart? I mean, how's that work?
Well, we try to present every case to the attending physicians. We really want people to know that we don't work in a vacuum, that we're not out there independently, diagnosing and treating people. We have an attending physician with us at all times that we can bounce cases off of, and which is a great, attribute for us because we, are able to see maybe a more complex patient that way.
Okay, so when you're in the emergency room, there's always a physician, a doctor who has a license on duty.
Absolutely.
Now, so you'll see a patient who comes in the emergency room and already their wait is shortened, right? So I think that in itself is very attractive to some people, right? So the wait is shortened. And Tom, let me tell just a little personal story.
Sure.
Speaking of physician's assistants, et cetera, some of my audience remembers that I went to the Naval Academy in Annapolis, and I was on a Mediterranean cruise with the Navy, not a vacation cruise, but a working cruise. We got a couple days shore leave, and somewhere in the Mediterranean, I stepped on a sea anemone and got about 30 of those spines in my foot. I went back to the ship, and of course, to see a surgeon was probably a helicopter lift out of there, at least 2 hours away, but I was seen by the corpsmen. And medics in the military are corpsmen. The guys and women are very accustomed to that. And actually, I've been told in World War II, they taught the corpsmen to be able to do appendectomies because the trauma surgeons, or the surgeons, were all assigned to be closer to the front lines or way back home where the injured soldiers and sailors were sent. So I think that corpsmen and medics, so-called physician extenders, have a pretty long history in this country, especially with the military. So, but when did, before we go on more and talk about the emergency room, when did physician assistants, or when did that concept sort of take root more in this country?
Well, your corpsman segue was perfect because it started in the early 60s, and it actually started with 3 Vietnam veteran corpsmen who aligned themselves with a physician at Duke University. And this physician outlined this category of mid-levels and literally started the PA program at Duke University. And it has allowed a greater delivery of healthcare.
So it started in Duke. Any idea how long ago that was?
Early 60s,
In the
61,
early
62.
Oh, well, this is almost 50 years now that physician's assistants have been being incorporated into our medical system.
Exactly.
And I understand now there's a true shortage of physician assistants, isn't that right?
And there's about 75,000 practicing right now.
75,000. Okay, so Mr. Trotter, so we've touched on a little bit about quality, that we know that when you're on duty in the emergency room and you see a patient, there's always a physician there to back you up or that you can run a case by. Now we can talk about safety a little bit. Now, does the physician always review your chart before you put in sutures? Do you run that story by the doctor? How's that work?
Almost always we do. And in each of the hospitals I've worked at, we have 100% of our x-rays reviewed by physicians as well.
Okay, so we know that physician's assistants are certified.
Mm-hmm.
I mean, we can say, are you licensed in California? There's a certification process.
Not actually licensed, where it's certified. There's a slight difference there.
Okay, and we've talked about the quality, that your charts are reviewed, your x-rays have to be backed up by somebody. There's always a doctor on call, or not on call, just actually physically present right there. And we know that's shortened the waiting time, right, for patients?
It has.
Well, are there certain conditions, certain problems, certain illnesses or injuries that you guys are mandated to have the doctor with you, or that the doctor prefers to take care of himself or herself? How's that work?
Well, absolutely. The beauty of having the mid-levels in the emergency department is we can absorb some of the minor cases that otherwise the physicians would see that might occupy their time, so they wouldn't be able to have a timely response to a more serious case, which they will still see in our presence. So while we're seeing, the minor fractures or lacerations, and something comes in by ambulance that needs prompt care, they can certainly go take care of that case immediately.
Okay, I also read something interesting to me, Mr. Trotter, was that I think the majority, over 50% of the problems that come into an emergency room are appropriately handled by a mid-level personnel, what we'd call a physician assistant, such as yourself, or a nurse practitioner. It's amazing to me that it seems like it's appropriate for more than 50% of the problems that come into the emergency room that it's appropriately handled by a mid-level person. And even simultaneously with that, you still have the doctor there at any time for backup,
We do.
for consultation, et cetera. Now, and also, everybody's concerned about economy. It's not only quality, safety, and the length of their wait, but economy. Now, is there a safe number that limits the number of PAs that can be working in an emergency room under the direction of one doctor, or is it 1-to-1, or can it be 1-to-20, or 1-to-10?
I'm not sure. I've heard the term 1-to-4, that any physician can have up to 4 mid-levels working underneath them. But in the emergency department, at least in the one that I'm aligned with now, there are, at any time, there's 3 to 4, even 5 physicians on at one time. And right now we will only have one PA at a time. So we have plenty of overlapping coverage.
Okay. Well, Tom, I know that the same as in medicine and surgery, people can subspecialize. I'm a plastic surgeon. I just had Dr. Meckel on, who's an orthopedic surgeon. Some PAs, or physician assistants, prefer the medical aspect of the emergency room. They prefer maybe seeing hypertension out of control, or they might prefer to see chest pain. Other PAs might prefer to sew people up, or they might want to see a broken arm. Do you have a preference to what side you go to?
I prefer the procedural side. I like reducing dislocations and helping with fractures. And of all the things that we do, I really enjoy sewing.
Well, I know you're good at it. I know we're not quite ready to make you an honorary plastic surgeon, Mr. Trotter, but I know you're good at sewing. So that brings me up to my next topic. So you are not allowed, under your certification, you can evaluate wounds and numb them up and wash them out and put in sutures.
Absolutely.
So are there things are there certain times that you feel like you need that the doctor there right with you, certain type of lacerations or injuries?
If I have a question about laceration, and usually, and I think some have even come your way, the hand lacerations where you're worried about some underlying structures being compromised, the tendons, some of the blood vessels, even the nerves. Before I will close that wound, I like to have a physician come in and we'll open the wound, we'll explore it together and make sure that we're not missing any of the underlying structures. So if we need to refer it on to a specialist, then we're doing it appropriately.
I see. Tom, let's back up a little bit and talk about, let's say we've got a high school student listening or watching the program, and they feel like they may be interested in medicine or surgery. They're not sure that they want to go to medical school or go through residency, but they like the idea of working with doctors and nurses. Who makes a good PA or nurse practitioner?
I think someone who's conscientious. It's someone who likes to expand their level of intelligence, who knows their boundaries, but wants to experience something a little more exciting. And I think probably the number one thing is somebody who's conscientious.
Yeah, well, I appreciate that. Certainly being conscientious is a great personality trait that helps out in a lot of different fields. Tom, let's teach a little bit more about that training period. Okay. So is it a year training? Is it less?
No, it's actually, the PA profession is modeled after the medical model, and it's a 2-year program. And it's modeled after the first and third year of medical school. So your first year is generally classroom work. There is some hospital time. And the next year, similar to the third year in medical school, is doing rotations actually in hospitals with residents, with medical students. So and some of the PA programs actually are taught along with the medical school.
I see. Well, let's talk about that in more detail. So the first and third year of medical school hasn't been that long ago. I remember it quite well. So the first year is a lot of basic sciences and a lot of time in the classroom and the anatomy lab. So we might have things like biochemistry and applied physiology and anatomy, a whole entire year of what we call science-based or basic sciences, teaching and learning. And then the third year is a lot of clinical rotations.
Exactly.
We'd spend a few months in surgery, a few months in obstetrics and gynecology, a few months with the pediatricians, a few months with the internists. Is that right?
Exactly.
So talk a little bit about more. Talk a little more about that. So your first year, you were in your program. Were you right with the medical students?
Well, in my program, we didn't have a medical school associated with us, but we had 3 medical schools in the same city. And so we were when we were doing our classroom work, it was just the PA students. Most of our classes were taught by practicing physicians in the greater Boston area. And then our second year, we were with medical students and residents in our rotations.
So Tom, let me back up for a moment. I got that you're from San Diego, but I don't remember hearing about Boston. So you got your PA training in Boston?
Yeah, and a master's degree in Boston as well at the same time.
So where in Boston?
We lived in downtown Boston. It was the school was Northeastern University.
Northeastern University. Well, I bet there's some friendly competition with Harvard and Boston University, et cetera. Boston's a great town for education and medicine and young people in general.
It's a great experience.
So I know, Tom, you're good at your job, and tell us about the hours that you might work. Let's say an average week. What's your average week like?
It's usually 3 to 5 shifts a week. The shifts are 10-hour shifts, and it's in the ER there is some downtime, so it's not always hustle and bustle for 10 straight hours. But it's a busy week. Even at 3 shifts a week, it's busy.
Right. What, Mr. Trotter, for example, at the hospital closest to us, neither of us are official representatives of the hospital, of course, but at the hospital where I do a lot of my work, Community Hospital Monterey, there's an emergency room side, and then there's also what we call express care, right? So let's talk a little bit about the difference between express care and the emergency room, and then of course I want to know, are there PAs in the emergency room, are there PAs in express care, et cetera?
That's a good point. We do have the 2 sides of the emergency room, our main ER and the express care. The express care is more like an urgent care, doctors on duty, Monterey Bay urgent care. And we see the more minor ailments. Right now at the hospital I'm with, we just have PAs in the express care. In other hospitals which I've worked, up in Santa Cruz, back in Boston, and in the Salinas area, you are in the main ER as well. And I think we're going to hopefully move that way when we expand our PA core.
Okay. Well, Mr. Trotter, I tell you, I'm no stranger to the emergency room and to express care, and I think you guys do really high quality work. And certainly, the wait times have been shortened, and I think the quality is certainly high and the safety is there. And I'm delighted really that you came on the program to teach our community about physician's assistant. You're a great example and a great representative of your profession.
Thank you, Dr. Morwood. It was a great opportunity.
I hope you come back again.
Thank you.
And this has been the second segment of Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. We're going to come right back after a very brief pause for a very good cause.